you're kind of away from your main computer or your main notebook or calendar or source of information that you normally use to anchor your information work. So we translated some of these findings into some real requirements for design to try and support this kind of work. Some examples of that are to make sure that it's mobile. Like we talked about, it can happen anywhere, any place, any time. You're not going to necessarily have even your laptop with you. Make it easy to capture. If you're in the grocery store and it takes you 3 minutes to get out your notebook and type in the information, it's just not going to happen. Is there a way to make sure that you can connect your personal and health information, because they're both relevant to what's happening? An easy example of that is your calendar. From the beginning scenario, we talked about the patient having to coordinate her chemo schedule around important work meetings, or vice versa, scheduling the important work meetings around the chemotherapy. Those calendars are interlinked. You don't necessarily want your work network to see your chemotherapy schedule, but it's pretty nice to be able to see those things integrated together from your perspective. You want to look at tracking your symptoms and side effects and see if you can understand when you're going to feel worse from chemotherapy, or when you should take that pain medicine to try and help reduce the pain you're experiencing from your treatment or from your cancer. All of these kinds of things feed into decisions we had to make for the mobile technology that we looked at developing for HealthWeaver. So this is an example, or this is a shot of what we developed. It's really